The measles virus, or the rubeola virus, is one of the more famous paramyxoviruses because it causes the dangerous and highly transmissible measles disease. The measles virus is good to know about and be familiar with because it has been in the news a bunch lately and is front and center in the heated vaccine debate in our country. The measles disease has a very classic and testable prodrome when it affects a child. It is commonly referred to as the 3 C's. The C's include cough, conjunctivitis, and coryza. Coryza is just a medical term for a head cold. Just means that there's a head cold. Personally, I like to add the 4th C, that stands for Koplik spots. Yes, I know Koplik spots starts with a K, but putting a C here helps us remember that Koplik spots happens in measles. So we have the 4 C's, 1, 2, 3, 4, including cough, conjunctivitis, coryza, and Koplik spots. Koplik spots are 1 to 2 millimeter gray-blue macules that appear on the buccal mucosa, as seen here in this image. This image is very high yield for step 1. If they show an open mouth of a sick child with a rash or with a conjunctivitis and maybe a cough, you should be immediately thinking about the measles virus. After the development of these Koplik spots, the characteristic rash of measles begins to appear. This rash, as we see here, is an erythematous maculopapular rash that typically begins at the hairline and spreads downward. Think about pouring red paint over somebody's head and watching it spread down the head, down the face first, and then go on to the shoulders, trunk, and then continuing down to the legs and feet. Complete recovery from the measles occurs within 7 to 10 days from the onset of the rash. So we see the rash, and then within 7 to 10 days, we see recovery. This is different than the rubella syndrome, in which we see a rash and then recovery within 3 days. And this is because rubella tends to be more mild than the measles disease. To help fight off this nasty disease, vitamin A has been used to reduce mortality in sick children. With that said, still the best way to not get sick from the measles is to prevent it altogether with the MMR vaccine. This is a live vaccine that protects us against the measles, mumps, and rubella virus. This is the controversial vaccine that some people in this country think and correlate with autism. Another reason it is super important to prevent the measles infection with the MMR vaccine is that because the virus can hide out and stay dormant for many, many years before it causes a nasty but thankfully uncommon disease later in life. So it can become dormant, and then after many years, the virus can reappear as subacute sclerosing panencephalitis, or SSPE. SSPE is a chronic encephalitis that causes inflammatory white and gray matter lesions in the brain that can occur 6 to 15 years after apparent resolution of the initial measles symptoms. Symptoms of SSPE include neuropsychiatric changes, seizures, coma, ataxia, and even myoclonus. So it is important to remember that the measles virus can behave both as a young child and as a mean teenager. As a young boy, measles will cause cough, rash, coryza, conjunctivitis, which is no fun for the child who is infected. However, if the virus is able to hide out and mature into a rambunctious teenager, it can cause a severe and life-threatening infection in the brain known as subacute sclerosing panencephalitis.